Hello, everybody. My name is Dr. Zha. I am a physician at CBHA, also the clinic lead liaison of the CBHA COVID-19 task force.
Hello, everyone. My name is Dr. Jude Alsarraj. I'm a clinical team member here at CBHA, and I'm working with Dr. Zha on the COVID-19 task force.
And we're back to answer some more questions.
Yes, and I'll ask you the first question, Dr. Zha. So, should I inject or ingest disinfectant or bleach into my body to treat coronavirus?
The answer would be no. So I want to let people know that these really strong disinfectants, including bleach, can cause really bad cell damage, which means that it can come into your body and kill cells that can cause massive organ damage, and you can actually die from such things. We do trust our community can continue to use our common sense to avoid such damage, even if that is popular in the social media realm.
So the CDC has added a few more symptoms to the list of possible COVID-19 symptoms. Can you update us a little bit on that?
Yes. So the most common symptoms of COVID-19 continue to be cough and fever. And this is a respiratory infection. Most of the symptoms are still going to be respiratory. However, another symptom that we're paying attention to is new body aches and muscle pain. This is a tricky one because many people these days are utilizing this time to exercise and such. If you just went through an intense exercise and you're supposed to have some muscle soreness, that does not count as body aches or muscle pain. So this would be for no reason, you're aching all over kind of thing. Another thing is a new headache might be an indicator of COVID-19. And so this is usually, I want you to pay attention if you're somebody who does not get headaches at all, and all of a sudden you're having this bothersome headache and it cannot go away with just Tylenol and ibuprofen. That might be a symptom for COVID-19. Other things include sore throat, and I think we talked about this before, loss of sense of smell or taste can also be a symptom. But I want to mention that these newer symptoms or less common symptoms usually don't stand alone. They're usually accompanying each other or accompanying that cough and fever. But if you have questions, we're here to help you answer those questions and for screening as well. So speaking of new symptoms, I do hear about this rash, some skin findings. Can you tell us about that, Dr. Alsarraj?
Yes, so actually many European countries, such as Italy, Spain, and also France, they reported that some skin conditions can be associated with COVID-19. So there's a study that was done in Italy where they looked at 88 patients of the ones who were hospitalized with COVID-19, which is the coronavirus. Disease, and those patients, there were 88 patients, 18 of these patients had skin conditions, which is 20% of these patients had skin conditions. So the conditions varied. So some patients had redness on the skin, others had some kind of hives, widespread hives, which like little, bumps, red bumps on their skin. And there was one patient who had a chicken pox-like blisters. Also, they've been seeing some kind of rash in the toes, and they're calling it COVID toes. So this is one of the skin conditions that they have been seeing. But we really need more research, more studies to look at that. But if you notice any new skin condition that you suffer from, please call us here at CBHA, and a provider will evaluate your condition. And if you need to come to the office, to the clinic, they will schedule an appointment for you.
So my next question is, I hear that at CBHA here we are starting to ask people to self-swab for the COVID-19 testing. Can you tell us more about that?
Yes, so we're currently offering the option of self-swabbing. And so when you come in to get tested for COVID-19 caused by coronavirus, we give you the option to do your self-swab. And it's really easy. What you need to do is open the nasal swab as if you're opening like a Band-Aid. You can take it, just make sure, take it out, don't touch the tip. So make sure that the tip stays clean, and then you're gonna need to swab the nose. So you're gonna put it in, insert it really carefully and gently until you kind of have some resistance, and then you're gonna kind of turn it this way around in a circle, touch the sides 4 times, and then use the same swab to go into the other nostril and just kind of do that same thing 4 times back and forth. When you're done with that, just make sure they're going to give you a tube. So put it in the tube, tip down, do not touch the tip, and you can close it with the red top, I think, the red cap on tightly. So this way, you're doing it yourself in your car, or you can be doing it here in the office if you like. So we're going to give you this option. And if you're doing it in a car, make sure you close the window and do it yourself, and then you can hand the tube out to the medical staff there.
Yeah. And we're going to walk you through this too before we ask you to do this, and we're going to observe you to do it as well, so that we know for sure that you're doing it right. This is a good point to talk about when I think people are noticing that we're asking people to be evaluated outside as the weather gets warmer. When you have coronavirus-like symptoms, or when we worry that you might have it, you're evaluated outside in our clinic. This is a measure that a lot of other clinics are taking as well. We feel good about that because of the fact that we're separating you from the rest of the clinic patients and staff to keep things ventilated and keep the staff safe and keep you safe as well. At the same time, we have built this new area of rooms that are totally negative pressure. And so 3 new exam rooms that we built with a new wall that is built between that area and the rest of the clinic. If you do have to come in from outside to be evaluated, there are places for you to go and they're safe as well. We're ready to receive you in these rooms. This area for COVID-19 patients or respiratory symptom patients are completely separate from the rest of the clinic. This is to protect the staff and the patients who come into the regular area. This area is not only physically separated with the wall, but also the air filtration is separate as well. There's almost zero communication between the air in this area than the regular clinic. So if our scheduling staff call you to schedule your appointment, regular appointment, even when it's not COVID related, for you to come in to see a regular doctor, I want to reassure you that this is the safe thing to do. If we didn't think it's safe, we wouldn't ask you to come back to be seen. And from all the measures that we just talked about, we're committed to keeping you safe here at CVHA when you come to see your regular doctor.
So the last question, Dr. Zha, is will this be over as the summer comes? Is this a time to relax physical distancing? Because we have seen that the results of social distancing, especially here in Washington State, it really made a huge difference in the numbers that we would have seen otherwise. But the virus is still spreading steadily, and if we don't take precautions and just go back to like our normal life, we'll see the numbers of infections arise, and also the number of deaths. It will just rise just because of that, if we just relax it too much. So can you give us a little bit of your opinion on that?
Yes, there is a recent study that is published in Science Medicine that has raised the possibility or the question regarding social distancing. Is this something that we will have to do in the next few years, intermittently or continuously? They have made some prediction models. Many of the models actually say that we might be dealing with coronavirus or COVID infection for the next few years. Might be in terms of smaller outbreaks or bigger outbreaks, maybe comes and goes with season changes, but nonetheless, it'd be something that we might have to live with for the next few years. That means that we will have to eventually might be dealing with not just cold and flu season, but might also be dealing with COVID seasons. That means that sometimes we have to fundamentally change the way we interact with each other out in the world. Maybe social distancing is not the right term for describing what we're going to be doing, because it really is a physical distancing. You want to keep your healthy physical distance. However, you can remain emotionally and socially connected and continue to support each other through this crisis time.
Great. Okay, so this is for today, everybody. So have a great day, and we'll see you next time. Thank you.